Okay, welcome everyone. I'm Laura Lamott, a Government Project Officer in the Center for Substance Abuse Prevention, Division of Primary Prevention at SAMHSA. And today I have the honor of serving as the facilitator for Strategic Prevention Framework, Partnership for Success, New Grantee Orientation for States. Next slide. Before we get started, I'd like to share that all attendees have entered the webinar in the listen-only mode. You can submit a question to the presenters using the question and answer box. So please feel free to use this feature as we go through the presentation. There will be time allotted at the end to answer the questions that have been submitted. And grantees will receive a copy of the PowerPoint presentation at a later date. Next slide. So over the next 2 hours, we'll embark on a journey in which we will discuss the purpose and program requirements for the SPIF PFS grant program. We'll discuss ways to address participant protection concerns, learn best practices for the management and post-award administration of the grant. We'll take a quick dive into SAMHSA's reporting system, and we'll receive an overview of the technical assistant providers. And then we'll round out the session with a discussion on the Disparity Impact Statement, followed by the Q&A. So the goal for today's orientation is really to provide you with the knowledge and the resources to successfully manage your new CSAP grant award. So before we dive into the meat of the program, I'll turn the presentation over to the Director for the Center for Substance Abuse Prevention, Captain Christopher Jones, for a welcome message.
Thank you, Laura. I appreciate it, and welcome to everybody who's joining the kickoff meeting today. Congratulations on being part of this new cohort for the SPIF PFS state program. This is really one of our most important discretionary grant programs. It's our largest discretionary grant program outside of the funding that comes out for the prevention set aside in the block grant. So it is really a place to help build capacity at the state level and to work with communities to also build capacity for those who are not yet competitive for our community-based funding. And again, you know, the work of prevention is incredibly important, more important than it's ever been, given the trends that we're seeing around the country and the continued shifts in substance use epidemiology, the toxicity of the illicit drug supply, and the ever-present persistence of things like cannabis, alcohol, and vaping nicotine products. So really appreciate all the work that's going to be here. I had the pleasure over the summer of traveling to a number of states who are getting awarded this funding and hearing some of the plans that they have with us and the innovations that they want to use this funding to support. So I really look forward to hearing about those innovations and successes, and know that this is really just the start of a collaborative journey together. Some of you have been through this before, and you've previously received SPIF or SPIF PFS or what the precursor programs before that. And you know, my goal as a director for CSAP is to make sure that you're getting the support that you need from our GPOs, from our divisions, from our technical assistance providers. So please see us as partners. Our goal and what makes us successful is you being successful in your efforts. So please don't hesitate to reach out. You're going to get a lot of information today, but it is really just the beginning of that partnership. And we're here with you throughout the life cycle of this grant to support your work and to lift up the important work that you're doing. And how cool is it that we get to do it during Prevention Month? A time where we're trying to really tell the prevention story and talk about the impact of prevention in communities. And now you are embarking on new investments and new resources and new innovations to continue that long tradition of prevention excellence. So thank you very much. I'll turn it back to Laura, and appreciate all the folks in the CSAP team who made this meeting possible today. Like I said, there's a lot that happens on the back end to make this successful and to support your efforts. So thanks again for that as well.
Wonderful. Thank you for that warm introduction, Captain Jones. Next slide, please. Thank you. All right, so let's begin with a brief overview of the future that CSAP envisions, and we'll answer the question of how SAMHSA realizes this work. Well, we do this through visioning. We envision a future where individuals, families, and communities are healthy and thriving. We also do this through an established mission by providing leadership and collaboration across sectors to advance prevention across the lifespan. We aim to prevent the initiation and the progression of substance use. And also we aim to prevent and reduce the harms that are associated with substance use. We accomplish our vision and our mission with data, prevention science, communication, collaboration, and strategic program investments, such as this PFS grant. Next slide, please. So the Strategic Prevention Framework Partnership for Success, or the SPIP PFS grant, is overseen by a two-person SAMHSA team. So first we have the Grants Management Specialists, or the GMS, and they oversee the day-to-day business and other non-programmatic aspects of the grant. So they're going to be your point person for all fiscal matters related to the award. And we'll learn more about the role of the GMS later on in this presentation. Next, we have the Government Project Officer, or the GPO, and they'll serve as the point of contact for any programmatic and technical aspects of the grant. And on your notice of award, also referred to as the NOA, the GMS contact information is listed on the first page under Block 9, and your Government Project Officer is listed under Block 10, as shown as on this screenshot here on the slide. So please review your notice of award in its entirety, and then especially to identify these important points of contact. Next slide, please. Okay, so your Government Project Officers are part of the Division of Primary Prevention. And since you'll be working closely with your GPOs, let's take a minute to introduce you to the Government Project Officers. So we have Pierre, Clark, Tiana, Michelle, Charlotte, Kamisha, Jacqueline, Kabai, and myself, Laura. Next slide, please. Next, we have Lucretia, Kemi, Lauren, Heather, Lisa, Moretta, Mary, and Tia. As you can see, we're all smiling because we really do love our jobs as GPOs. Next slide, please. All right, so this brings us to the overview for fiscal year 2024 Strategic Prevention Framework Partnership for Success Grant Program for States. Next slide, please. The purpose of this grant is to help reduce the onset and the progression of substance misuse by supporting the development and delivery of state and community substance misuse prevention and mental health promotion services. So the SPIF PFS program, it's grounded in that strategic prevention framework. And that's a community engagement model that's grounded in public health principles, including being data-driven and focused on providing evidence-based services to underserved communities. Next slide, please. So through this program, grant recipients will focus on strengthening prevention capacity to identify and address local substance use prevention concerns. Grant recipients are asked to use various public health data to identify prevention priorities in your communities, so to really figure out what's going on, and then determine and develop and implement strategies to prevent the misuse of those substances. They're also asked to utilize a data-driven approach to identify any underserved communities and subpopulations of focus. And then lastly, the SPIF PFS is authorized under Section 516 of the Public Health Services Act as amended. Next slide, please. So as I previously mentioned, this grant program is grounded in the Strategic Prevention Framework. affectionately known as SPIF. So the SPIF is a 5-step planning process to guide states in the selection, the implementation, and evaluation of effective and culturally appropriate and sustainable prevention activities. So this SPIF process will assist grantees to use a data-driven approach to really identify those communities of high need and at-risk populations of focus. Next slide, please. All right, so now that we have a high level of understanding of the purpose of the grant program, we want to share some quick highlights of the PFS-24 grantees and grant program. So for fiscal year 2024, CSAP awarded 10 states, and you can see the list here on the slide, for a project period that covers 5 years. For a complete list of award recipients, we encourage you to visit SAMHSA's website, and there is an active link on the slide. And there you'll be able to view a list of community and tribal recipients that were awarded in your state for this fiscal year 2024, and then for other years as well. Next slide, please. So this grant program requires the hiring of 2 key personnel. And key personnel are staff members who must be a part of the project regardless of whether they receive a salary or compensation from the project. So we have the project director, who's responsible for the oversight of the entire project. And then we have the data analysts, and they're responsible for the epidemiological data and program analysis. Both positions have a required minimum level of effort of 50%. And if there's any changes to these positions, that does require prior approval by SAMHSA. And then lastly, it's important to note that the project director and the data analyst cannot be the same individual. Next slide, please. The Notice of Funding Opportunity, also referred to as the NOFO, includes required activities for the grant. And required activities are activities that every award recipient must implement. So the state should use this award to build the capacity of underserved communities with high substance misuse to really strengthen those communities to implement and sustain prevention services. States are required to effectively promote and implement evidence-based interventions and practices by the subrecipients to really maximize positive health behaviors and prevention outcomes. And then funds must be used primarily to support the development of substance misuse prevention and mental health promotion services. So the NOFO provides a timeline for these required activities, and we'll review those next. Within the first 45 days, the recipients must identify points of contact with the SPIF PFS community tribe recipients that are funded under this NOFO. So the states will work with the community tribe recipients to establish a plan for regular engagement and to ensure that coordination of efforts. This will also help to address any gaps in prevention, improve networking relationships, and promote partnership within and across the communities. But please note, this is only required if there's a recipient under this NOFO in your state. So again, if you have any questions about that, please reach out to your government project officer. Next slide, please. So within the first 90 days, the recipient will assess, collect, and identify data sources and any gaps in that data. The recipient will then develop a statewide community health assessment. And then we ask that you use these results to develop a statewide community health improvement plan to address substance use prevention across the state. Something that's long-term, a systematic effort to address public health problems. So now I'll hand it over to my colleague and fellow GPO, Pierre Thomas, to continue discussing the required activities timeline.
Thank you, Laura. Okay, so within the first 180 days, the recipient will identify eligible underserved communities and existing local community prevention providers, organizations within the state that may be in the development phase and are not yet eligible to apply for the SPIF PFS award through SAMHSA. For example, communities and tribes. They will initiate efforts to engage and partner with these organizations for targeted substance misuse prevention. To identify these communities, the state should review state epidemiological data or other relevant data if the state epidemiological data does not include all relevant underserved communities, such as sexual and gender minorities. States must provide the criteria and justification used when identifying these communities. Sorry, I think I just jumped a page. I did. States will also develop strategies to enhance the capacity of community-level prevention providers that use a minimum of 60% of their award to fund subrecipient communities or community providers that demonstrate a need for programming in their selected prevention priority or priorities as dictated by data. Connect and orient local community prevention provider organizations to SAMHSA's Prevention Technology Transfer Center, PTTC, and enhance the fiscal management of community subrecipients by providing technical assistance and guidance on sound fiscal management. States are also asked to expand the data collection and analysis capacity of community subrecipients by providing technical assistance on local level reports and provide technical assistance to community subrecipients on strategies to ensure sustainability. Identify opportunities and activities to foster collaboration, partnership, and engagement among state subrecipients and recipients of the SPIF PFS Communities and Tribes Award. Within the first 180 days, states are also asked to submit a strategic plan with the fourth quarterly report. Throughout the award, the state will establish and implement strategies, including the use of technology and partnership across the state aimed at the community level that support the wide dissemination and adoption of evidence-based and promising practices in substance misuse prevention. State grantees are asked to develop an evaluation plan for identified targeted strategies and populations and identify strategies and implement plans to build the capacity of subrecipients through technical assistance, integration with community partners, and sharing of resources that positively position subrecipients to prepare and complete applications for prevention award, including the SPIF PFS Communities and Tribes Award. Allowable activities are an allowable use of grant funds, but are not required. Allowable activities may include identifying and collaborating with entities serving the selected communities and populations, such as substance use disorder treatment providers or recovery community organizations, local harm reduction coalitions, as well as emergency medical services and agencies, for example, 988 or your local crisis call center. Now that we understand the required activities for the grantees, let's take some time to discuss the data collection and project performance assessment requirements. At the core, all SAMHSA recipients are required to collect and report certain data so that SAMHSA can meet its obligations under the Government Performance and Results Modernization Act of 2010. To further understand the purpose of reporting, we look at reporting requirements through three lenses. The first lens is program monitoring. The grantee should be using the data they collect to monitor and adjust their program throughout the life of their grant. Data collection and reporting can be used to answer the question, are we having a positive impact on the community? The second lens is program-wide impact assessment. CSAP and SAMHSA uses data collected from PFS grantees to assess the program-wide impact of PFS. These data help us answer the question, what is the result of the investment in the PFS program as a whole? Documentation and compliance. The third lens we use is for documentation and compliance. We are looking to see if the grantees are using the funds appropriately. We also use these data to understand what came out of SAMHSA's investment in PFS and if there are lessons that can be learned for future prevention programming. Recipients are required to report performance, including the following measures: number of people served and/or reached by IOM category, so universal, selected, indicated, the 6 strategies, and demographic group. Over the next couple of slides, we will dive further into the data collection and performance measurement requirements. In addition to the measures mentioned on the previous screen, the required reporting includes 5 additional components, starting with the annual targets. The annual targets include community prevention message and outreach, along with individual and small group prevention services. Grantees will coordinate with their GPO to set targets each year for the number of individuals they plan to reach with community prevention outreach activities and how many individuals they plan to serve with more intensive prevention services. These data will feed into the quarterly inputs. Grantees report each quarter on their progress toward their targets, their annual targets. The report is due within 30 days of the end of each quarter in SPARS. Earlier in the presentation, we mentioned that grantees are to develop an evaluation plan for identified targeted strategies and populations, as well as the identification and assessment of strategies and approaches used to build organizational capacity at the community level related to prevention. This is the foundation for the impact reporting model. For this model, the grantee will identify up to 3 community-level prevention priorities to address. For each priority, the recipients will need to develop an impact reporting measure which links the program or activity inputs to community-level impact. At a minimum, the reporting model must include the following for each priority area. The first variable is the intervening variable, risk factor reduction. Examples include survey data measuring the knowledge, attitudes, and perception of the target audience the program is planning to reach. The second variable is an intervening variable, protective factor promotion. Examples include survey and other data tracking uptake or increases in protective factors such as participation in after-school activities or family communication. And the third variable in the consumption or behavior variable, or is the consumption or behavioral variable, excuse me. This could be survey data measuring the actual behavior of the target audience. For example, a survey may measure past 30-day usage of a particular substance. The last variable for the annual report is the consequence variable. This includes survey data or data from external data sources showing the impact at a community level, including substance use related crime, hospitalizations, accidents, or school discipline. Now let's take a moment to conceptualize what these variables look like in action. We use the schematic to show how the community goes from input to impact. For this example, we have a community-based organization that works with young adults at high risk for alcohol use. This organization provides a series of interventions offered in school and out of school. The input variable for this community-based organization are those evidence-based practices used in the intervention. The young adults that participate in the program complete a baseline and post-intervention survey to measure their perceived risk or attitudes towards alcohol use. When analyzing these surveys, the community-based organization notices that the participants' understanding of the perceived risk of alcohol use improves over time. To understand if the participants are turning this knowledge into action, the organization distributes a past 30-day usage survey. And they find that over time, the rates of consumption declines. Next, the community organization explores the outcome indicator, where they track if the reduction in consumption is having a positive impact at the community level through reduced crime, hospitalizations, accidents, or school discipline. For this example, the community-based organization found that the school disciplinary actions related to alcohol use declined as a result of the program, which would be considered their community impact. Now, I'm going to turn the presentation over to Commander Candice Griffin for a discussion on participant protection.
Thank you so much. Are you able to hear me?
Yes.
Thank you. Good afternoon, everyone. My name is Commander Candice Griffin, and I serve as one of the Center Participant Protection Officers in CSAP. As a part of the application process, you all had to complete a section on participant protection. So thank you all for doing that, and congratulations on getting the grant. In the next few slides, I'll highlight the key aspects of participant protection as it relates to policy, compliance, and the process of satisfying the requirements of the SAMHSA grant application process. Next slide, please. First, I'd like to talk about participant protection governance. When we focus on human research, the overarching perspective is to ensure that we protect the rights, welfare, and well-being of the research participants. While we're not doing academic research, our grantees are still responsible to ensure that their program participants are protected. The key regulations for us are listed here: 45 CFR 46, 42 CFR Part 2, Code of Federal Regulations, the 7 participant protection guidelines, which I'll discuss in the next slide, and HIPAA, the Health Insurance Portability and Accountability Act. So let me touch on a few aspects. Highlighting 45 CRF 46 and 42 CRF Part 2, there are 2 points I would like to emphasize. First, the regulations reflect human participant research that is conducted or supported by a federal department or agency. Secondly, human participant research not directly conducted by a federal agency and is administered through an agency, institution, coalition, requiring governance and approval by the Institutional Review Board, IRB. In both situations, the research involves human participants. For SAMHSA, our focus regarding the regulations present as grant programs which may have research involving the use of educational tests, survey procedures, interview procedures, or observation of public behavior. The research involving the collection or study of existing data, documents, records, pathological specimen, or the diagnostic specimens are additional examples. It is very important to have safeguards protecting individuals from risks associated with their participation in SAMHSA projects. The participant protection human subject guidelines were developed to ensure that the rights, privileges, and privacy of participants are protected throughout a study or program. Adhering to these guidelines also protect all those involved in the program, including the funding agency, the grant organization, and participants. When applying for a SAMHSA grant, all applicants must address the 7 participant protection elements, including in the Notice of Funding Award. Next slide, please. So here are the 7 elements that I'm going to briefly discuss. SAMHSA has participant protection requirements because it is important to have safeguards protecting individuals from risks associated with their participation in SAMHSA projects. So the first element is to protect clients and staff from potential risks. And I want to reiterate that because it's important that when you are addressing that element, that you address it for clients as well as staff. So this is the section where you will identify and describe foreseeable risks for both staff and participants who participate in your program. This is where you provide guidance and assistance in the event that there are adverse effects, which would apply to the community being served and those providing services to community members, for example, uniformed first responders. Under fair selection of participants, this is where you want to describe the actual population of focus and explain the reasons for selecting or not selecting certain groups. Some of you may be located in rural areas or big cities. Either way, the demographics of your population is key here when you're discussing fair selection. The third element is absence of coercion. In this section, it's where you explain if a participant this is where you explain if participation is voluntary or required. An example of that would be court required or mandated. This element is also where you specifically address if any compensation is being offered for participation. The fourth element is data collection. This is where you identify your source of data and the data collection procedures in detail. This is the section where you tell us who you're going to collect data from, how you're going to collect that data, whether it's via survey, a paper copy, electronic, whether it's through focus groups, things of that nature. Was your survey link or document submitted for review? This is the section where you would also send us a copy of the survey that you're using or either a link to the survey that you're going to be using. The fifth element is privacy and confidentiality. In this section here, this is where you talk about the parameters of how you ensure that that data that's collected remains confidential. Where do you store that data? Who has access to that data? Is that data password protected? Things of that nature. The sixth element is adequate consent procedures. So in terms of this, we want to think about the use of the appropriate type of consent forms based off of your targeted population. If you have minor participants, do you have assent forms or sections that include room for their parent or their guardian to sign? If your described population demographics include those under 18 years of age, please don't be surprised if you will need to provide additional layers of protection for those who are considered vulnerable populations. Additionally, how will you address if a participant no longer wants to contribute to the data collection process, but still wants to receive services for the project? It's important that you're able to have that discussion with them and explain that they will still receive services, even if they don't want to participate in other aspects of the program. And the last element is risk-benefit discussion. And this kind of leads back to the first element when you're talking about the potential risks. In this section here, we want to know if the benefits of participating in your program outweigh the risk. This is also a section where we would like for you to actually list the benefits of participating in the program. Now, there may be some sections where a grantee feels like some elements that the grantee may feel like those are not applicable to the program. If you feel like that there are elements that are not applicable, you're able to say that, but you will need to justify that in detail as to why you feel like that particular element is not applicable to your program. Can I have the next slide, please? Okay, so this final slide is just an example of what a participant protection term and condition may look like in your notice of grant award that was discussed a little bit earlier. Your notice of award includes all of the special terms and conditions that may be associated with your grant. The participant protection term and condition is just one of those special conditions. So there are, I believe, 4 grantees that have a participant term and condition currently. I want to say thank you to the ones that have already sent me responses to their term and condition. If you're not sure, if you're one of the 4, please go back and read over your notice of grant award in detail. It should be under, I think there's a section 4, special terms and conditions. And if you do have a participant protection term and condition, it should be listed there. If you're not sure, you can reach out to me. My email is in the slide here, candice.griffin@samhsa.hhs.gov. But it should look like this. And again, my email address, as well as the other CSAP PPO, Lieutenant Kawana Cohen-Hopkins, we're both listed in your term and condition, and we can assist you in any way. If you do have a term and condition for PPC, your responses are due by October 30th, 2024. I highly recommend that you get your responses in earlier than that so that I can review those responses and work with you if additional information is needed to satisfy your term and condition. Is anything else? If there are any questions in terms of participant protection, again, please feel free to reach out to me. Or if you have a question while we're on the call, please put it under the question and answer section, and I'll be happy to respond to those. Again, congratulations. I do ask that you all check your NOA, your Notice of Grant Award, to make sure that you do not have a PPC term and condition. And if you do, please submit your responses through ERA no later than October 30th, 2024. Thank you.
Great. Thank you, Candice. Next, we'll hear from Diane Lee, Grants Management Specialist.
Thank you, Laura. Hi, everyone. My name is Diane Lee, and I am the Grants Management Specialist for the SPF PFS States Grant Program. Next slide, please. I will be going over the roles and responsibilities, ERA comments, the notice of award, post-award amendments, the federal financial report, grants management tips, key due dates, and will provide resources in managing your grant. Next slide, please. Roles and responsibilities of a recipient. A recipient, also known as the grantee, is the organization that is awarded a grant or cooperative agreement by SAMHSA. The authorized organization representative, the AOR, is the designated representative of the recipient in matters related to the award and administration of the grant. The AOR certifies that the recipient will comply with all applicable assurances and certifications referenced in the application, and that the recipient will be accountable both for the appropriate use of funds awarded and for the performance of the grant-supported project, and is responsible to SAMHSA for ensuring that the organization complies with applicable federal laws and regulations. In grants.gov, this role is identified as the AOR. In ERA, this role is the signing official, or the SO, and is the person identified in Section 21 of the SF 424. Sometimes the SO also may be referred to as the BO, which stands for business official. And as previously mentioned, there are 2 key personnel for this program, the project director and the data analyst, both with at least 50% level of effort. Please note that the SO/AOR and the project director must be different individuals. Next slide, please. The responsibilities of the recipient include but are not limited to being in compliance with the terms and conditions of the award, implementing approved activities, cash management, records retention, and reporting requirements. Failure to comply can result in drawdown restriction or other special conditions. Next slide, please. Along with your GPO, the Grants Management Officer, the GMO, and the Grants Management Specialist, the GMS, will assist with your award. The Grants Management Officer is responsible for the business management aspects of the grant and for the interpretation of grants administration policies and provisions of your award. The GMO for this program is Rosalie Vega. The Grants Management Specialist, which is me, is responsible for the financial and administrative management of your grant and other non-programmatic aspects of the grant. Next slide, please. The grant system that SAMHSA uses is NIH's Electronic Research Administration, also known as ERA. Correspondence from ERA will come from the 2 email addresses listed here. The project director of the award must be registered in ERA, and here is the link to register. Next slide, please. In managing your grant, here are a list of different tasks that you may need to do in ERA with guides on how to do them, including responding to special terms and conditions, responding to a request for additional materials, also known as a RAM, submitting a post-award amendment, and updating your information in ERA. These links are very helpful, so please keep them for reference. Next slide. And here are a list of examples of when to contact ERA Service Desk for assistance, such as submission issues, errors and warnings, and if you need to change the signing official of your grant. To contact ERA, you may submit a ticket via their website or call them at the numbers listed on the slide. Next slide, please. The Notice of Award, also known as the NOA, is the authorizing award document from SAMHSA. Please read your NOA in its entirety. It contains important information, including your award amount, terms and conditions, and reporting requirements. By drawing federal funds from your award, recipients agree to abide by all applicable laws, regulations, program requirements, policy, and terms and conditions. The recipient is responsible for carrying out approved project activities, may only charge to the grant allowable costs from obligations incurred during the budget period, and not obligate grant funds for project activities after the project period has ended. Next slide, please. Project and budget periods. The project period is the total time SAMHSA has approved a project for support. The project period for this grant program is 5 years from September 30th, 2024 to September 29th, 2029. Within the project period are budget periods, which are usually 12 months long. The chart here shows the 5 budget periods broken down by the years. Next slide, please. Now we'll go through an overview of the different sections in the Notice of Award. Section 1 of the NOA is the award data and has information on the award calculation, which shows how much money is allocated to each budget category, the grant amount for each year, and the accounting information. Next slide, please. Section 2 has information on the Payment Management System, also known as PMS, which is a system used for your payments. Here is the PMS website, contact information, user guide, and training information. If you have any questions regarding your PMS account, please contact your PMS liaison. And to find out who your PMS liaison is, please use the link listed here. Next slide, please. Requesting reimbursement payment from PMS should be on an as-needed basis. Federal funds must be expended within 3 business days, and any funds not spent within the 3 business days must be returned as you should not be holding excess cash. As of April 1st, 2022, recipients are no longer required to complete the quarterly federal cash transaction report. Next slide, please. Section 3 is the standard terms and conditions, which explains the award rules and regulations. It is the recipient's responsibility to understand and comply with them, and failure to do so may result in enforcement actions, including termination of award. Next slide, please. Section 4 of your NOA has remarks, special terms, special conditions, and standard terms of the award. Here are some examples of what may be included in each of the sections. And when submitting required documents for these sections, they should be submitted via the ERA Terms Tracker. Next slide, please. In the special terms section, it lists 2 funding limitations for this program. They are no more than 10% of the total award for the budget period may be used for data collection, performance measurement, and performance assessment. And a minimum of 60% of the total award for the budget period must be used to fund subrecipient communities that demonstrate a need for programming in their selected prevention priorities. This information can also be found on page 24 of the NOFO. Next slide, please. Section 4 also has information on unallowable costs. Recipients must ensure that costs charged to the award are allowable, which is costs are necessary and reasonable. Allocable, costs can be charged and are in accordance with benefits received. And reasonable, costs are not more than the usual. And that is the end of the NOA overview. Next slide, please. Next, I will discuss post-award amendments. When information on the NOA needs to be changed, it will require approval from SAMHSA before the recipient can implement the modification. The instances where approval is required are referred to as post-award amendments. It is required when you are requesting the following: a budget revision, a change in key personnel, a change in scope, a no-cost extension, a merger, successor and interest transfer, organization change, or formal carryover request. The request must be submitted via ERA. A verbal approval is not binding. And here are links to our website with more information and how to submit the request. Next slide, please. And I will go over 2 common post-award amendments, one of them being a budget revision, which is required when there is a reallocation of funds that exceed 25% of the total budget or $250,000, whichever is less. The purchase of a unit of equipment exceeding $25,000, or when there is a reallocation of funds to unapproved cost categories. The request needs to include a cover letter on letterhead with a justification, a revised budget, and the SF-424 and the SF-424A. Next slide, please. Another common post-award amendment is a change in key personnel. This is required when a key personnel, which for this grant program is the project director and data analyst, is replaced, or there is a separation from the project for more than 3 months, or 25% reduction in level of effort. The request must include a cover letter, resume, position description, SF-424, and the SF-424A. Again, all of this information can be found on our website. Next slide, please. The Federal Financial Report, also known as the FFR or the SF-425, is due annually no later than 90 days after each budget period. The budget period for year 1 for this grant program ends on September 29th, 2025. So the first FFR is due December 28th, 2025. FFRs are submitted through PMS And here is a link on how to submit it. And you can also manage your FFR through ERA. Next slide, please. And these are just screenshots of submitting the FFR through PMS and accessing it through ERA. Next slide, please. And here are some grants management tips. Grant-related requests must be submitted in ERA, and please include the award number in the subject line of the email. For programmatic questions, please contact your GPO, and for financial questions, please contact me. Our contact information is listed on the first page of your NOA. For budget revisions, we highly recommend using SAMHSA's budget template. It's easy to use, has all the budget categories, information required, and most of the cells auto-calculate, so there is less chance of calculation errors. Next slide, please. And here are some key due dates for special terms and conditions. Please refer to section 4 of your NOA. And as I just mentioned, the federal financial report is due no later than 90 days after each budget period end date. Next slide, please. And here are some links for resource and guidance in managing your award, including our budget template, information from our website, and ERA how-tos. And next slide includes more links, including the notice of funding opportunity, blank templates of the SF-424 and SF-424A, and a sample of the SF-424A with instructions on how to complete it. Next slide, please. And here is a table of whom to contact for assistance with issues and questions you may have regarding your grant. And this concludes my presentation. Thank you.
Thank you, Diane. We'll now hand it over to Shannon Von Dross from the Office of Prevention Innovation to discuss reporting.
Thank you. Next slide, please. So today I'm going to cover the reporting requirements for your grant, and that's going to include the Programmatic Progress Report, which includes your annual impact reporting, the CSAP online reporting tool or the CORT, our data reporting system, SPARS, as well as your reporting due dates. Some of these we've already mentioned earlier in the presentation, so I'm just going to give a little bit more detail and context, but they're not additional requirements to what we've already discussed. Next slide, please. So first, we'll start with the Programmatic Progress Report, or the PPR. Next slide. Recipients must periodically review their performance data to assess their progress and use this information to improve the management of the project. The project performance assessment allows recipients to determine whether their goals, objectives, and outcomes are being achieved and if changes need to be made to the project. An annual Programmatic Progress Report, or PPR, must be submitted in ERA Commons within 90 days of the end of each budget period. The report must include reporting period activities, accomplishments, and progress toward achieving program goals and objectives, evaluation updates and outcomes, including your annual impact reporting or outcomes data, planned activities for the upcoming reporting period, as well as any challenges experienced and mitigation strategies implemented. A template will be provided for completing the PPR. Next slide. As previously mentioned, you'll report on the impact of your program annually using surveys and external data sources in an impact reporting model. This will be submitted as part of your PPR and must include, at a minimum, the following for each priority area. 1, an intervening variable for risk factor reduction, for example, perception of parental or peer disapproval of substance use. 2, an intervening variable for protective factor promotion, for example, participation in after-school activities. 3, a consumption or behavior variable. An example of this would be past 30-day use of a particular substance or set of substances. And 4, the consequence variable, for example, substance use-related traffic accidents. Next slide. Your annual impact reporting, often referred to as annual outcomes data, will be submitted annually as part of your PPR and should include data collected during the budget period. During year 1 of the grant, we also ask that you submit baseline annual outcomes data with your PPR. The baseline data will ideally reflect data collected from the federal fiscal year prior to grant funding. These baseline and annual outcomes data should be reported at both the grantee and subrecipient levels where possible. The suggested data collection periods are listed here on the slides. When reporting outcomes data, please be sure to include any relevant information about your data, including but not limited to the data source, any population parameters, including the age or grade level of your participants, the valid N, and anything else you feel might be important for us to know in order to understand the data being reported. Next slide. Next, we'll discuss the CSAP online reporting tool, or the CORT, which will include your annual targets, quarterly performance reports, and work plans. The CORT consists of three main parts: the annual targets report, quarterly performance report, and work plans. The annual targets reports are where you will set goals for the reporting period, which is the federal fiscal year. Your goals will include proposed prevention strategies to be implemented, as well as estimated numbers of people that you plan to serve or reach through your grant activities. The annual targets report for year one of your grant will be due on April 30th, 2025, and on October 31st for each grant year thereafter. In the quarterly performance reports, you will report on progress toward meeting the goals you outlined in your annual targets report. You will report which prevention strategies you implemented, as well as actual numbers served and reached, as well as provide a brief narrative summary on grant progress, successes, challenges, and innovations. Quarterly performance reports are to be submitted to SPARS within 30 days of the end of each federal fiscal quarter. The CORT is still making its way through the government approval process, or OMB, and we anticipate its approval in November. While it is still going through the OMB process, we will provide a draft copy of these measures for your program planning purposes. Although unlikely, there is a small chance that the measures will change slightly from the draft to the final approved version. Next slide. As I mentioned, the goals set forth in the annual targets report will directly relate to the performance measures reported in the quarterly performance report. For example, in the ATR, you will report how many individuals you plan to reach, whereas in the QPR, you will report on how many individuals you actually reached during the reporting period. Next slide. There are 4 work plans that are required for this program: the statewide community health assessment, the statewide community health improvement plan, the evaluation plan, and the strategic plan. The statewide community health assessment is a state, tribal, local, or territorial health assessment that identifies key substance use prevention needs and issues through systematic, comprehensive data collection and analysis. The statewide community health improvement plan is a plan to address substance use prevention across the state that is a long-term, systematic effort to address public health problems. The evaluation plan will describe how your prevention strategies will be assessed and establish outcome or impact measures tied to the original problem that your grant program plans to address. Finally, the strategic plan is a written document that includes assessment results, identification of prevention priorities, strategies to be implemented, and sustainability plans for the program. Your project officer can provide more information on what should be included in each of these work plans. Next slide. Okay, next I'll give a brief introduction to our data reporting system called SPARS. Next slide. SPARS is SAMHSA's performance accountability and reporting system. It is the online platform or website that we use to collect grantee progress and performance information, including information that we need to fulfill the requirements of the Government Performance Results Act, or GPRA, and the GPRA Modernization Act of 2010. Your CORT data, including the annual targets reports, quarterly performance reports, and work plans, will be submitted using the SPARS system. The data you submit to SPARS allows SAMHSA to report on key outcome measures and will be reported to the public as part of SAMHSA's congressional budget justification. Next slide. SPARS accounts will be created automatically for project directors. Project directors will receive an email from the SPARS system when their accounts are ready. We anticipate that SPARS access will be granted to project directors in November. From there, project directors may complete an add or remove SPARS users form in order to request SPARS access for additional program staff. Next slide. This is what your dashboard will look like within the CSAP area of SPARS. The top portion of the screen shows your quarterly performance reports. The bottom portion of the screen is where you will see your annual target report and any work plans such as the strategic plan and the evaluation plan. If you hover over the cog on the right of your report or work plan, you'll see an action menu. From there, you can edit, export to PDF, submit to your project officer, or view the status history of your report or work plan. Next slide. SPARS will also house resources to aid you in data collection, reporting, and use of the SPARS system. This will include a copy of the court, a question-by-question guide, as well as training videos. These resources are still in development at this time, but we will share them with you as soon as they are available. We will also be hosting trainings and office hours related to SPARS and the court in the coming months to help answer any questions you may have ahead of your data submissions. Next slide. If you have technical questions related to the SPARS system, you can reach out to the SPARS help desk either by phone or email. You'll see their contact information on the help tab of the SPARS website. If you have any questions about the data collection tools, including the court, please reach out to me. If you have questions about grant implementation, please reach out to your GPO. And if you're not sure where to turn for help, your GPO can help you determine where to go next. Next slide. I know that was a lot of information in a short amount of time, so the next slide just provides a really brief summary of the reporting requirements I just discussed. Next slide. So these are the reporting requirements we just went over for your reference, including where each report should be submitted and when. As a reminder, your first quarterly performance report is due on January 31st, 2025 for any activities completed during quarter one. Next slide. With that, I want to say thank you so much for your time today. And if you have any questions about SPARS or the reporting requirements, please feel free to submit questions in the Q&A.
Great, thank you, Shannon. Now we'll have Ingrid Donato to review the helpful technical assistant resources that are available.
Hello, everyone. Hope you are doing well. I want to add to the congratulations to all of you on your new grant award. This, as Captain Jones mentioned, is such an incredibly important grant program in substance use prevention space, and we're very excited to see what you're going to be able to accomplish. So as I was looking through the list of the new grantees, it looks like many or perhaps all of you are returning folks. And I'm wondering if you could, through a show of hands, if you go into the reaction and do like a thumbs up or something like that, if you could let me know if you are returning grant program. Are you experienced in the work? This is old hat. You're like, I know all of this already, you guys. All right, I'm seeing a lot of thumbs up about that. So are there any of you who are new? This might be your first grant, CSAP grant, or you might be new to this work. And just do the same thing. You can do thumbs up or raised hands. All right. So we got some new folks as well. So really excited. So I just wanted to, my name is Ingrid Donato. I am the director of the Office of Prevention Innovation. I work with Shannon, who just went through the SPARS presentation. And I know we're going to do Q&A at the end, but I did want to share for your returning folks. I know we previewed this back in April, and I know a number of you participated in providing comments and we're participating in the cognitive testing of it, but we're doing a new approach to data collection. So we're hoping that it will ease the burden on you, really refining and collecting just the information that is really critical to our understanding about the work and allowing us to report back to Congress about what is, what's happening with the grant program, and to get rid of those fields and those elements that are that we were underusing the data in there. So thanks so much for those of you who participate. And I do want to emphasize, this is new. 24 data, you're going to keep on doing what you used to do. 25 is a brand new day. You should have received or will be receiving an email invitation or an Outlook invitation to a more detailed training about the new data collection approach, where we'll walk through it in more detail, answer more questions. We're booking this is a major change across SAMHSA. I've been across CSAP, so we're making a lot of appointments. And And I realize that yours is on election day. I don't know how I missed that. November 5th there's one at 3 p.m., which is state focused. One at 4 p.m. is for community focused. These will be recorded. There's lots of other opportunities out there, but I just wanted to share a little bit. Okay, so with that, let me tell you a little bit about technical assistance. Since a lot of you are, old hands, I'm going to be quizzing you a little bit about the resources that we have to make sure you even know about them, but still sharing some of this information for our new folks. So could I go to the next slide, please? So first, I want to start with what is technical assistance. It's a term that we use here all the time. And sometimes we forget when there are new folks that are coming on that this might not be common terminology in your work. So TA or technical assistance in a nutshell is the provision of expertise and support to help address a specific issue. It is sometimes referred to as training and technical assistance, or TTA. We use those sometimes interchangeably, and it is used to build capacity within your organization and ensure programs are as successful as possible. Next slide. There are different ways that TA can be used. As you are starting your new grant program, you may want to have some assistance in a variety of areas, right? You can get technical assistance support in selecting evidence-based strategies, in developing logic models, in providing content expertise about particular issues and challenges, and as I mentioned, to build that capacity. We know that you are all extremely competent and qualified and fantastic preventionists. We know that your program is going to roll out beautifully, but we also know that issues and challenges come up, and everyone might need a little bit of help on some elements of their grant. And we want to make sure that you know that reaching out for help and support is not viewed as a bad thing. It's viewed as a great thing, as we know that you're invested in making your program as successful as possible. Next, so SAMHSA invests in a wide range of technical assistance resources. CSAP invests in a smaller number of them and focuses on 2 major technical assistance centers that I want to share a little bit about. Next slide, please. The first one is called SAMHSA Strategic Prevention Technical Assistance Center, or SPTAC. So folks who are, have had other CSAP grants before, this is their second PFS or, other grant programs. Have you heard of SPTAC? First, if you can do that same thing, we do the thumbs up. All right, good. Getting a couple of thumbs up, right? I was looking, I track on what they're doing, and I know that they've been really engaged with you folks. So SPTAC is our technical assistance center that's really focused on our grantees. So they provide resources and supports really to make sure to help you make sure that your grant programs are as successful as possible. SPTAC has a strong focus on implementing the strategic prevention framework. Lots of expertise in that, are real go-to folks to working with that. They also do a lot of work around EPIs and the state epidemiological outcomes work groups. And they can be a particularly helpful resource in developing your work plans. So I know that your statewide community health assessment and your statewide community health improvement plan are going to be due relatively soon. Those are first on deck. They'll help you with it. They helped the last cohort with it. So they're already prepared to help. Just need to reach out and talk to your GPO, and I'll put the link in there as well, and you'll get more information about SPTAC. So they're really the go-to technical assistance center for that grantee specific work. Next slide, please. And SPTAC is regionally based. So as you'll see here, there are specific technical assistance providers for each of the different different regions across the country. So you will likely you'd likely be reached out by these particular TA providers, but keep those names in mind as they're the ones that will likely be your go-to for support around speed technical assistance. Next slide, please. So our second technical assistance center, the second major technical assistance center that we support is the Prevention Technology Transfer Centers, or the PTTCs. Similarly, has anyone heard of the PTTCs? Use the PTTCs. Well, same thumbs up would be really great. Wonderful, wonderful. Seeing lots of thumb raises, which is great, which is not surprising. They've been around for a while. You know, we just awarded the second 5-year grant to them. So we're very excited to move to be continuing this really great work. So the difference between what Speed Tech does and what PTTCs do is that PTTCs are field focused. Their resources are available to everyone and they are accessible. You can go there and you can access resources on a wide range of topics. The PTTCs are really our go-to center for workforce development. So as you are hiring new staff, as you are upskilling or getting your staff really engaged in this work, the resources that are available through the PTTCs will likely be very useful for that. They have SAPITS training. They have the Prevention Core Competencies training modules. If you haven't checked those out yet, those are a set of 6 training modules that you can take whenever you want. They're on demand that really go through all of the core, the foundations of prevention work. So really great resources as you're hiring your staff. They have ethics trainings. They have additional trainings for your more experienced staff, and really are able to create that learning pathway to credentialing. Also on the Prevention Technology Center website is a map where you can click on your state and look at the criteria for credentialing as well. So that's a big focus of it, but they also have a wide range of webinars, of toolkits, of fact sheets, really around the work that you can do. But I'm getting a little ahead of myself. So next slide, please. So as I was beginning to describe, they have quite a number of resources. They've developed over 1,000 so far. And as we're rolling out the next grant program, that will continue to be a resource to look at the information that you need really to help do the work that you do. As I mentioned, there are a lot of resources through the PTTCs around that skills development, around building the credentialing pathway. They also really help in thinking through, they're tracking on and think through those big issues that come up in the prevention space and help with that. They run a set of work groups that are focused on particular topics. Since their new grant is kicking off just like yours, there'll likely be a new set of these working groups, but these are ones that were done with the previous cohort: implementation science, making data-informed decisions, cannabis prevention. There'll likely be a lot of similar work, but we'll be really moving, adding additional work that reflects what's going on right now. Next slide, please. They are also regionally based. There is a national coordinating center that manages all the work, but you'll see there's also a particular center that's focused on the issues that are pertinent to your particular area. Make sure that you are on their listservs, that you're connecting with them so you can be receiving information on local trainings, local webinars, local resources that are available. Again, this map will be adjusted slightly with the new cohorts as we roll around, but many of them are the same. Next slide, please. SAMHSA, as I mentioned, also supports a wide range of other technical assistance centers to help you with the work that you do. The Evidence-Based Resource Center houses information about how to select evidence-based programs, how to implement them, and there are particular resources related to substance use prevention. The Suicide Prevention Resource Center houses a lot of important information, obviously, around suicide prevention. We know that's not the focus of your grant program, but we also note that you are likely addressing issues around suicide prevention while you're addressing issues related to substance use prevention. These topics, these issues don't occur in isolation. So we know that you're tackling a number of issues in the work that you do. There's also a Center of Excellence for LGBTQ plus behavioral health equity. We know that they are an important population that you are likely prioritizing. And these are just a small sample of a number of the additional resources that are available to you, free of charge, by the way, for you to use to make sure your programs and your staff have the resources that they need. Next slide, please. You can find all of these and more on the practitioner training tab on SAMHSA.gov. I put the link down there that you can bookmark. You can scroll through all of the different resources. As you can see, 988 has resources on there that might be helpful for you as well. And we're actively working to make this section of our website a little more user friendly. So there'll be we're working on developing like a search tool, so you can click on topics that might be interesting for you, and the right TA resources pop up. Right now, it's a little challenging, but we're working on it as quickly as possible, and so keep an eye out for changes with that. So that really is the that's the information that I wanted to share with you during this portion. 2 take-home messages, but it sounds like you are actively aware of them and that you're engaged with them. SpeedTac is your resource, your go-to resource for the Strategic Prevention Framework and that grantee-specific work. When you're thinking about your work plans, if you're struggling with them, they're your go-to folks, and we'll help you with that. The PTTCs is accessible for the nation. You go there, you can scroll through, find the resources that are available, get on the regional listserv so that you're getting the up-to-date information for what's happening in your region, and they're really the go-to for workforce development. So thank you so much for your time. Please don't hesitate to reach out to me or any of my staff for any questions. And I'll pass it on to the next slide and to our next presenter. Thanks a lot.
Thank you, Ingrid. We'll now be joined by Tenley Biggs with the Office of Behavioral Health Equity.
Thank you. I'm actually going to turn it over to Martha Kent. So Martha, take it away.
Okay, great. Thank you. Hi, everyone. My name is Martha Kent. I am in the Office of Behavioral Health Equity. I work there along with Tenley Biggs, and today we are going to talk to you about the Disparities Impact Statement. We first want to say congratulations on your grant award. And next slide, please. So the Disparity Impact Statement is commonly referred to as the DIS. We use those 3 letters. We love our acronyms. And the DIS is a data-driven quality improvement approach to help us to address equity in our program. It's used to identify underserved and historically under-resourced populations that are at the highest risk for experiencing behavioral health disparities. And it also gives grantees an opportunity to identify disparities within their communities and describe how their grant funds will be used to address those disparities that they identified. Next slide, please. So the Disparity Impact Statement came from a 2011 HHS Disparities Action Plan. The then Secretary of HHS asked all agencies to assess and heighten the impact of HHS policies, programs, and processes, as well as its resources to reduce health disparities. And as a result, in 2012, SAMHSA released the Disparities Impact Statement. We were the first HHS operating division to incorporate a health disparity impact statement. And it started with just piloted with 4 grant programs. And then in 2013, we released the Disparity Impact Statement to all of SAMHSA. Next slide, please. So this slide illustrates grant enrollment demographics of 6 Center for Mental Health Services grants. The grants reflected on this particular slide are the Mental Health Block Grant, the Protection and Advocacy for Individuals with Mental Illness grants, the Project for Assistance in Transition from Homelessness or PATH grants, and then Children's Mental Health Initiative. We also have the CCBHC, which are our Certified Community Behavioral Health Clinics. And lastly, the Treatment for Individuals Experiencing Homelessness grants. Those are the grants that are displayed here. And this particular slide shows that there is disproportionate enrollment of individuals. As you can see that individuals that are in the white category is significantly higher than the enrollment of other races. And next slide, please. So the reason we do the disparity impact statement is ultimately to create greater inclusion of underserved communities in SAMHSA grant programs. And in doing so, it helps grantees to identify underserved or under-resourced populations, develop a plan to address the needs of those communities, and then ultimately increase the diversity among people served in SAMHSA programs. Next slide. The disparity impact statement is a term and condition, so it would have been listed in your notice of award that you received a few weeks ago. It is submitted in ERA Commons. It's due 60 days after the award. And grantees are asked to upload their disparity impact statement in ERA in a PDF form. And then you're also asked to provide at least an annual update on your progress on your progress of your disparity impact statement goals, at least annually. Next slide. So the disparities impact statement is broken into 3 components or 3 sections. So in section 1, it focuses on asking the grantees to identify the behavioral health disparities. In section 2, it asks the grantees to tell us how they will address those disparities using the funding opportunity. And then in the final section, it asks grantees to develop a disparity reduction quality improvement plan. So we're going to discuss these sections on the next slide. Next slide, please. So this slide, although it's pretty small, is our simplified disparities impact statement form. We're working on having a form that could streamline the process of completing the disparity impact statement and give grantees an example of more of what we're looking for. So this form is hopefully to be released on our website in the coming weeks. However, if you want to get started now on completing your disparity impact statement, you could still use the same forms that are already on our website, as well as those resources. They are still relevant. And the links to those resources are available at the end of the presentation. So on the last slide. Next slide, please. So this first section, it asks grantees to identify behavioral health disparities by identifying underserved, under-resourced, or marginalized community that they wish to impact. And then secondly, it asks grantees to discuss the actual behavioral health disparity that they wish to impact. So this question is a little different because we're asking to identify a particular disparity that you want to try to close the gap. Next slide. So this slide gives some examples of behavioral health disparities. And so when you're thinking about your disparity impact statement, because it's asking you now to identify a behavioral health disparity that you would like to impact, these are some examples of disparities. For example, suicide was the leading cause of death for Asian American and Pacific Islanders ages 15 to 24 in 2019. Black and AIAN women have pregnancy mortality rates that are much higher, like 3 times higher compared to white women. Racial and ethnic minorities are less likely to be prescribed medications for opioid use disorder. So that's just to name a few of the disparities that we were able to, that are well known and identified disparities. Next slide, please. So this slide asks you to use the funding opportunity to address social determinants of health and national class standards. So with that, it's how will you use the funding announcement to address these 2 items? Next slide, please. So this slide here that talks about the class standards is saying that, class standards, they provide the structure that help grantees ensure that their planned activities are aligned to culturally and linguistically appropriate standards. So that's the purpose of implementing a class standard. So some examples of implementing a class standard would be that standard 4, we want to educate, train, governance and leadership and workforce and culturally and linguistically appropriate policies and practices. So ways that you can observe culture in your organization to make sure that it is culturally and linguistically appropriate for all people. Next slide. So the social determinants of health, they are the conditions and environments where people are born, live, work, play, worship, and thrive. They affect a wide range of health functioning and quality of life outcomes and risks. There are 5 SDOH, or social determinant of health domains, which are economic stability, education, access to quality care, healthcare access and quality, and neighborhood-built environments, and social and community contexts. So grantees are asked to identify at least one of these domains and work towards improving access through that domain. Next slide. And this last section of the disparities impact is where grantees are asked to develop a disparity reduction quality improvement plan. So in this plan, grantees are asked to tell us how they want to work to close the identified gap. Next slide, please. And the last part of the disparities impact statement, which I don't think applies to this grant because you are not a services grant, is to complete a demographic table. So if you're providing direct services, you would complete a demographic table, but I don't think that you all are providing direct services. So if you are providing direct services, you would complete a demographic table that breaks out the number of unduplicated individuals to be served with the grant awards. And that would be based on demographic characteristics. That's similar to the table that you would have completed when you wrote the application. It was listed in the NOFO, or Notice of Funding Opportunity. And so you would fill that same form out in a similar format, but just break down the demographics of the people that you're serving. You would also use county health rankings and roadmaps. Next slide, please. This is an example of the table that you would use to tell us the demographic table that you would complete. And we have resources for that last column, which is a reference data column. It's for county health rankings and roadmaps, and it will help you to access the information. And if you're a state grantee, you would enter the information for the entire state. Next slide, please. So this purpose of this slide is to talk about, to show you again who SAMHSA is reaching in our grant programs. If you look at this slide, this is a slide of two programs, one adult drug court and minority AIDS initiative program. When you can see by this slide, it depicts that the FY21 combined enrollment demographics for these two programs shows that of the 6,866 people that were enrolled from 39 states and territory, that 9.6% of them were veterans. And if you look to the right, you can see the disproportionate enrollment, where it's 58.9% of people that were enrolled were white. Next slide, please. And this slide speaks to retention, meaning who's staying in our programs, completing our programs. And this slide shows that there is, again, this disproportionate completion rates or retention rates amongst our programs, which is why we just kind of foot stomp the need for the disparities impact statement to make sure that services are accessible to everyone. Next slide, please. So this concludes my presentation. I do have some resources available. One resource, the first resource, is to help identify behavioral health disparities that exist. You'll also see resources for the existing DIS trainings or disparity impact statement trainings, to learn more about class standards, as well as social determinants of health and ways that you could implement addressing those items in your communities. Next slide, please. And this slide lists references for the information that we provided above, where we were showing some examples of disparities that exist. Last slide. So thank you again for your time, and congratulations again. If you have any questions, please feel free to contact your project officer and or the Office of Behavioral Health Equity.
Wonderful. Thank you, Martha. So this concludes our formal presentation. For the remainder of our time, we'll answer any questions that have been submitted through the question and answer box. And the raise your hand feature should be activated so you can ask a question that way. And just as a reminder, you will receive a copy of the PowerPoint presentation and the recording at a later date. And at this time, we'll be joined by Fred Volpe, a branch chief for the Division of Primary Prevention. And Heather, if you can read the first question, please.
Absolutely. And we have our presenters, sorry, have been actually answering a lot of the questions, but I did want to read them because I think these were good questions that other participants may have. So we had one question asking if it is recommended to just use one variable per group, or if there is a max number of variables for those groups. And they were asking in regards to intervening variables, protective factors, risk factor reduction, consumption behavior, and consequence variables that Pierre had gone over earlier in the presentation. And Shannon had responded that it's only required to select one variable for the protective factor, risk factor, consumption, and consequence variables for each of the grantee's prevention priorities. We usually suggest selecting just 1 to 2 variables under each of these categories to decrease the burden on the grantee's end, but they are welcome to submit as much data for these areas as you would like, especially if you feel that it provides a better picture of the impacts of your program. If your epidemiologist has any further questions, they can reach out to Shannon, and she provided her email information. And also, you know, if that's always something too, like you can talk with your GPOs about. and have those discussions in those beginning calls, monthly calls. That's something that's usually pretty good to start talking about. So I just wanted to, I thought that was a really good question, and Shannon did such a nice job answering that. So I wanted to share. And we will be, I've been copying and pasting the questions and answers. So we will send the Q&A out as well when we send out the slides and the recordings. And then it was also asked when Candice was going over participant protections, if there was a template for that, for the terms and conditions. And Candice had responded that there is no template, and they can respond to each element that needs to be addressed in the term and condition, and submit those into ERA. And again, just a reminder, not every grantee had that. So double check your notice of award under special terms and conditions to see if you had any revisions or you needed to do anything additional for your participant protections on that. And be sure when you do submit those in ERA, be sure to email those to Candice and Kawana as well. And both of their emails are listed. If you have that in your NOA under special terms and conditions, their emails are listed. And if you can't find their emails, your GPO will have those. So those were just a couple of the questions. I just wanted to, like I said, I just wanted to read those questions and answers. So that's all we have right now. So if anyone else has any questions, you're welcome to raise your hand, or you're welcome to type it in the question and answer section. But our presenters did such a wonderful job. There may not be any. But this is a good time to ask, because not only do we have Fred, we have some other leadership on the call who also are pretty good with answering questions as well.
Well, if you don't have any questions, the truth is that you will. You'll have plenty of questions. And we have a really great group of project officers who will be able to answer each and every question that you have. As you start this journey, new folks, you know, we get the difficulties that there can be in recipient contracting, and the fact that, you know, you're going to have to ramp that up and get moving on it quickly. Also, that states that have done this have new staff. Nevada indicated that. And, you know, there's a lot to learn about this, and we'll be right with you all the way. And I'm sure you're going to do a great job. And this is a great grant. So congratulations.
While we have a minute, since I know we have some other leadership on, anyone else on our panel, any remarks to the group before we finish up? And again, if you think of a question, please put it in the Q&A or feel free to raise your hand. But just want to open it up to any other leadership on the call that might have some thoughts or anything they'd like to say to our new grantees.
Well, this is Damaris Richardson, and I would like to say welcome, welcome, welcome. We are so excited to have you on board representing our next cohort. Some of you have been around with us for a while, and we appreciate you recognizing the significance of this award and how it can make a difference in your community. And as Fred stated, for those who are with us for the first time, stay tuned because you're not alone, and we're going to be looking forward to working with you. You've heard a lot about TA support, lots of resources, and that's just the beginning. So again, please do not hesitate to ask any question. All questions are important, but we're just excited to have you on board with us, and stay tuned for more great things. Thank you.
We actually have a question. It says, since we are starting up and trying to set up contracts, is there an option to ask for an extension on the DIS due dates?
Do we have our DIS person here? On.
Hello, thank you.
Go ahead, Martha.
Hi. I would say that you would definitely want to speak with your project officer regarding an extension. And the DIS is really asking what's your intention. So you don't have to like have everything set up. You're really talking about what you're intending to set up.
And I'll just I know
Thank
that
you.
I've had this conversation with some of my grantees to always kind of look at the DIS too as sort of a living document in a sense, and I always go back to look at for this initial piece. We understand that you're setting up all these contracts and you're figuring out who your subrecipients are going to be and what their communities look like. Even though it's part of your state, we all know that each community has its unique needs that need addressed, and PFS really it's a data-driven program. So at the heart of that's what we want you to look at. But also look at your original application too, because Section B of your original application addresses some of that. Even though that was looking at the 50% threshold, you'll still probably have some of that data and information on those populations you're thinking about. As Martha said, the ones that you're projecting or looking to serve. But I always kind of have my grantees look at that as we should be updating it and looking at it, and you won't change the whole thing, but when we start out, we can keep it kind of like bird's eye view of your state, because it does present some unique challenges. And that's just one way that I look at it. And Fred, Damaris, Jerry, you tell me if I'm wrong, because that'd be a good time to learn it.
No, I think that was useful, and thank you very much, Martha. It really is. You should think of it as a future guide. You're going to have information now, but you'll be adding information and understanding as we go. So the important thing is that we recognize that disparities exist and that we become better and better and able to determine where these disparities are and view them against the lens of substance abuse.
Any other questions? All right. Anyone else before we wrap up? Any other leadership, any words, any comments, remarks?
Well, I'll just say congratulations, and we look forward to working with you all.
Jerry. All right, Laura, I'll hand it back over to you.
Okay, well, give everybody 15 minutes back of their day. And again, congratulations, and please reach out to your GPO or GMS with any additional questions, and you will be receiving a copy of the PDF of these slides and recordings. So take care and enjoy the rest of your day. Thank you.